Patients with chronic bronchitis suffer from chronic cough and sputum production. The current treatments are intended to either improve airflow obstruction, reduce to some extent the amount of mucus production, and improve the mucus clearance. However, despite the available inhaler therapies, many patients still complain about those symptoms and also have an increased risk of exacerbations. In fact, multiple studies have shown that chronic bronchitis patients have an increased risk of morbidity and mortality, are more frequent in hospital, and they have a severely impaired quality of life. The RheOx system is a catheter-based device intended to ablate mucus-producing cells within the airways. It is intended to be introduced into the airways using bronchoscopy. And we have used this technology to treat both sides of the lung sequentially, and non-thermal energy is applied to the airways, and with that there is subsequent ablation induced by apoptotic cell death. And given that the basement membrane as well as the extracellular matrix remains intact, there is potential for regeneration of the airway mucosa, reducing mucus, improving airflow, and helping patients to breathe better and have less symptoms of chronic bronchitis. So we've recently completed the first in-man study, treating about 30 patients in a multi-center study where patients were selected on the basis of having symptoms of chronic bronchitis. The majority of patients had either mild to moderate COPD, some few patients also had even chronic bronchitis without airflow obstruction. And the impairment of quality of life that these patients suffered and reported was also reflected by their symptom scores. So the design of the study was basically to recruit patients that were complaining about these symptoms, that didn't have frequent exacerbations, that were on optimal medical management, and then being treated in a sequential manner, treating the right side of the lung first, followed by the left side 1 month apart. And we also took cryobiopsies within the airways to ensure that the treatment we are applying is actually introducing the intended mechanism of action, which is ablating the superficial layers. The primary outcome of the study was actually safety. We wanted to ensure that in a first-in-man study, this is a safe procedure and doesn't create any problems with regards to airflow, airway obstruction, arrhythmias, COPD exacerbations. And in fact, the primary outcome with regards to safety was very reassuring. Only few patients had serious adverse events. But we've also looked into some patient-reported outcomes, such as symptoms of chronic bronchitis and overall well-being, and patients felt dramatically better on average. But in order to have an understanding whether the subjective improvements were paralleled by some sort of objective improvements as well, we also looked into the biopsies we obtained. And in fact, what we saw is that on average, the number of mucus-producing cells went down dramatically, confirming the mechanism of action. So we're about to start a new prospective randomized controlled trial using this technology in patients with symptomatic chronic bronchitis. And the trial design will be a sham controlled study. So one group of patients will receive the true treatment and another group of patients will actually receive a sham treatment. And we're looking whether or not this technology is able to improve symptoms of chronic bronchitis, coupled by some other objective assessments such as lung function, CT analysis, and other outcomes.